This is the limb examination of a fetus at the 15 weeks of pregnancy. You can see that the hand, baby has not clenched the fist and the hand is visible, and you can see all the digits, and it requires meticulous examination. And you can see all the 1, 2, 3, 4 and 5. You can see all the fingers and all the digits if you enlarge this image. And this is the way we see you can now see this hand clearly. You can now see this hand clearly. Other hand can also be seen. This hand is so beautifully seen, and the other hand can also be seen. This is the lower limb examination of the fetus around 15 weeks of pregnancy, and you can see that the baby has flexed the limb, and one foot can be seen here, and the other foot we have to work hard to see whether the second foot is visible or not. You can see that the part of the limb was visible in this previous scan. You can see that the foot baby is trying to one limb is flexed and the other limb is extended. Usually the babies around this gestation keep these feet like this, and though they can keep the feet in the other position also, but this is the usual position of the feet, and it's slightly difficult. One has to maneuver the probe, and one has to have patience to see the entire lower limb completely. And we can see the foot, because to rule out, you can see both the hands, and this is one hand, this is another hand, and this is one foot, and the other foot one has to see again. This is one foot, another foot, both the feet crossing each other, and both the lower limbs crossing each other. At times it appears that this might not be hand, so be careful and try to see the limbs carefully from the origin to the final foot or the hand, to make out whether it is hand, leg or the upper limb. And now you can see both the limbs clearly, and the alignment of the foot to the rest of the limb is normal. There is no club foot, and here also the baby has moved both the limbs, and both the limbs can be seen here. This is a 11 weeks fetus. You can see that the lower limbs are visible, but the feet are not visible. The digits may not be well visible. The hands are not very visible. This is a case of twin pregnancy. I'm trying to show you only one fetus. You can see both the limbs, and try to see all the limbs in 9 weeks onwards, and try to document that all the limbs are present. Here the fetus might show some wiggling movements, and the fetus is to be swinging. Here the second fetus also shows some limb birds over here. They should be clearly seen at this station. This is how the limb birds they look like, and you can see that these are the limb birds, upper limb and the lower limb, and one should try to enlarge the fetus and try to see maximum as possible.